Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our report on the COVID-19 pandemic. As we see week after week, month after month, the effectiveness of vaccines and how effective they continue to be. And the data from around the country, around the world, and locally as well show that importance. And now we're over 945,000 people in Allegheny County who have been vaccinated, almost 800,000 fully vaccinated, and about another 145,000 who are partially vaccinated. And about 40% of those folks have also received the booster shot, which is obviously very important. As we see the data continue to be piled up around hospitalizations, fatalities, and cases in general, the vaccine is just, those numbers are just very overwhelming. We know that the cases have risen over the last month or so, and many people have tested positive, and Dr. Bogan will report on that. But we also know that for the vast majority of the folks who are vaccinated, and especially boosted, that the symptoms have been mild. Again, not every single person, but the vast majority of people, the vaccine has really proven to be effective during the surge that has happened over the last month. So we continue to urge people to go get vaccinated, make sure they get that second shot, and make sure they get boosted, and we're there to help, and so many of our healthcare facilities are working to do just that. So now let me turn it over to Dr. Bogan to give her report. Dr. Bogan?
Thank you, County Executive. Good afternoon, and thank you for joining us again. As we enter the third year of the pandemic, I want to start by recognizing the fatigue that the length and complexity of this pandemic has had on individuals and our community. I, like many of you, am tired, but with spring and warmer weather around the corner, I'm also quite hopeful. Today, I'll start with our current numbers, update you on our current vaccination and testing, and remind you of resources available for pandemic response. Last week, we averaged over 3,000 new cases a day. Positivity rate remains high with a 7-day moving average of about 35%. Hospitalizations also remain high. Over 330 people were hospitalized the week of January 2nd. This is lower than the peak of hospitalizations in December of 2020, despite the far higher number of cases. This reflects the lower hospitalization rates with the Omicron variant and also reflects the impact of vaccines on lowering the risk of hospitalization. To that note, starting in mid-December, the rate of hospitalization increased significantly for children ages 0 to 4 years, the group for whom vaccinations are not yet available. Compared to the week of December 12th, when the rate of hospitalization for children in that age group was 1.6 per 100,000, the week after Christmas, that rate increased to 23 per 100,000. We continue to report COVID-related deaths. During December 2021, 210 county residents had COVID-19 listed as contributing factor for their death. That is the third highest month total since the pandemic began. We continue to monitor wastewater in our county. Results from sampling the first week of January indicated that more than 90% of the virus found in municipal wastewater was the Omicron variant. And now, nearly 2 weeks later, that proportion is likely much higher. In a cup-half-full analysis, our daily case counts have stabilized. We remain amid the Omicron surge that started in mid-December when we saw initial dramatic jump from hundreds to thousands of cases a day. However, if we follow the pattern of others around the country and the world, I hope that this plateauing of cases over the past 10 days portends an impending decline like other regions have experienced. Let me turn now to testing. As I said previously, we know that our cases are undercounted because of the increased use of home testing. Home test results are not added to the state reporting system. To improve our local estimate of cases, last week we launched a voluntary online self-test reporting form. The County Health Department tool helps us to better understand our local viral spread. These data will not be added to the state data, but we will report them separately. When residents self-report positive tests, They received the latest guidance on isolation and quarantine and links to more information. I'd like to thank our team for quickly creating this process and the over 560 people who have already self-reported their positive tests using the online form. If you would like to report your positive home test, please go to alleghenycounty.us/coronavirus and click on the link that says Positive COVID-19 Self-Test Reporting. Also on the topic of testing, the federal government yesterday launched a website where you can request up to 4 at-home test kits to be delivered by the U.S. Postal Service. The website is covidtests.gov, G-O-V. It only takes a minute to complete the form, and they plan to have a call-in number to request tests as well, but that is not yet available. Locally, we continue to partner with Curative to provide free testing throughout the county, and we continue to add new sites. For example, on Tuesday, 2 new kiosk locations were opened. One opened downtown at 1 Smithfield Street in the Human Services parking lot. It is open from Monday through Friday from 8:30 to 5 p.m. The second opened in Millville at 400 Lincoln Avenue at Mr. Small's. It is open Monday through Saturday from 1:30 p.m. to 9 p.m. Please make a note that some test sites will have modified schedules, for instance, later this week due to the forecasted extreme cold weather. So please check our social media pages for daily locations and schedule updates, or call 211 if you don't have access to the internet or you prefer to call. One thing I request is that people do not go to the emergency department solely for COVID testing. If you are ill and in need of urgent medical care, please go to the emergency department. However, if you're only going just to get a COVID test, I urge you to use one of our Curative sites or one of the many other community testing sites at pharmacies and through our health systems. I'm also going to take this opportunity to repeat the same message I give all the time. Please get vaccinated. Just yesterday, the State Department of Health reported data that show the life-saving abilities of the vaccine. They reported that between January 1st, 2021 and January 4th, 2022, unvaccinated or not fully vaccinated people in Pennsylvania accounted for 78% of the reported COVID cases, 85% of reported COVID hospitalizations, and 84% of reported COVID deaths. Keep in mind that in Allegheny County, less than 30% of the population remains not fully vaccinated, yet they continue to make up the majority of people who get hospitalized and die from COVID. Our current vaccination rates continue to increase. Currently, just over 70% of those 5 and older are fully vaccinated, and another 9% are partially vaccinated. I want everyone to get vaccinated, but I know that for some, you continue to have questions or concerns. I encourage you to go to the link that I mentioned earlier, alleghenycounty.us/coronavirus. Read our frequently asked questions section, or reach out to a healthcare professional you trust. Share your concerns and questions. It is not too late to get vaccinated. While we continue to have substantial community viral spread, I strongly encourage everyone to wear a properly fitted mask when in public settings and indoors. Remember that many people with Omicron variant have no symptoms at all or just mild symptoms, but nonetheless, they can spread this virus very efficiently. I also want to remind everyone that influenza also continues to circulate in our community. Influenza cases are higher than last year, but lower than typical pre-pandemic years. Like COVID vaccination, it is not too late to get your flu shot. At the Health Department, we aim to safely guide every resident through this pandemic. And with that, as we enter this 3rd year of COVID, you can find many resources on our county website or by calling 211. Resources include information on vaccine providers, testing site locations, food distribution, mental health resources, emergency rental assistance, and many other services. But I want to bring special attention to mental health. As I said at the beginning, it's been a long 2 years. If you're experiencing symptoms of loneliness, isolation, depression, anxiety, fear, frustration, etc., you are not alone. The pandemic has impacted our collective mental health. Please reach out if you need assistance. We in Allegheny County are extremely fortunate to have so many amazing community resources. With that, I wish a speedy goodbye to Omicron. Thank you for your time. Please be safe and be kind.
Home rapid antigen tests are not as effective in detecting the Omicron variant. Is this the case? And if so, should anyone who feels sick get a PCR test, even if their rapid test is negative?
That's a really important question about testing, and it's a little complicated, but I'm going to try to give the best answer I can, which is I like to think about rapid tests are best used in two situations. If you are feeling symptoms, a rapid test is a good way to go. But if there's a mismatch between your symptoms and the test result, that's when you want to think about getting a PCR test as well. So, for instance, you go in, you have symptoms, your rapid is negative, but you really feel like you might have COVID, it's probably a good idea to go get a PCR. In the case of using the rapid tests for asymptomatic, so you have no symptoms, you're just worried and you just want to test yourself really as a screening method, then the recommendations are to use two tests at least 24 hours apart. So that the tests, none of the tests are perfect, but the rapid tests are really meant for people who are shedding the virus actively at the time. So that's when they're best used, either as a screening test twice, or if you're symptomatic and there's a mismatch, to go get a PCR.
The next set of questions is from Public Source. Other cities have reported a peak in their surge. Is there any indication from current data that Allegheny County will see a decline in cases?
I think that I answered that. Our county executive, do you want to add anything to that comment? Hold on one sec.
Yeah, I think Dr. Bogan mentioned that in her remarks, that what we've seen in other parts of the world and certainly in other parts of the country where the Omicron virus has come first, surged first, and it mentions some states in the article. Pennsylvania and Western Pennsylvania was almost like in the second group of states that have seen the Omicron come. So those first group of states are starting to see the decline and the decrease. And I think, as Dr. Bogan mentioned earlier, we're certainly hopeful that we'll follow the same pattern as everybody else. There was another study in the New York Times that was published, I think it was this morning or yesterday, regarding internet-connected temperatures, temperature thermometers around the country, and we've seen those actually decrease as well as people the spike in temperatures that people have seen have also shown a decrease. So, as Dr. Bogan said, we're hoping we can say goodbye in the next few weeks or month or so to Omicron, and hopefully we'll follow the pattern that other places around the country have seen.
Wastewater monitoring showed the presence of Omicron before a case was confirmed here. Has wastewater monitoring revealed anything new about the pandemic's trajectory?
We are really just emerging into our wastewater program here. It has been used in other places, again, and we hope to use it here as well to really look at emerging variants, so we'll keep track of that. We also hope that we will be able to use it to model and predict future surges. So we are really just beginning that experience here in Allegheny County, and look forward to sharing more information as that program develops further.
Hospitalizations are near pandemic highs locally. Is there concern that local facilities will see demand beyond capacity, and what is the plan if that happens?
So I think I've addressed this before. Our hospitalizations are less than in the past. We also have, when the cases were extremely high last winter, we were in a very different place than we are right now in the pandemic. We have treatment options. We know how to treat the COVID. Our hospitals have lots of experience. And they've all developed really amazing contingency plans. So I'm not really concerned at this point that we're going to exceed capacity. Our hospitals have lots of planning in place to address surges like they've done. That's not to say that our hospital staff aren't tired. They've been working around the clock tirelessly for 2 years now, and this has been a big surge. But again, they've done amazing planning and response, and I am confident that they can continue to handle what is being sent their way.
These next questions are from the Tribune Review. Can you address the rise in pediatric COVID cases? All of the juvenile age groups have seen a spike since mid-December, but the 0 to 4 age range has seen a significant spike from less than 2 per 100,000 to more than 20 per 100,000.
Well, of course, that concerns me. I'm a pediatrician by training, and when young children are sick, we all feel it. But again, this is the only age group for which we don't yet have vaccines. And so we as a community have to do our part to reduce the spread of infection. And we can do that by using all of the strategies we know, wearing masks when you're in public, and getting vaccinated, because that reduces the spread of the virus. So in order to protect this vulnerable group, we should all be doing that until they themselves can also be vaccinated. So in terms of the hospitals, again, I encourage you to talk to Children's Hospital and other healthcare providers about how they're managing in their facilities.
Could Dr. Bogan talk about the significance or insignificance of the percent of cases among the unvaccinated, 48% of cases last week? Taking the numbers at face value might imply to some that they are just as likely to contract the virus whether they're vaccinated or not.
Yeah, that's a question. I'm going to remind, a long time ago, we gave this scenario where we talked about if everyone in our community was vaccinated, all the cases would be among the vaccinated, right? If you have 100% of your community vaccinated, then all of the cases will be among the vaccinated. And we know that as you increase the proportion of people in your community that are vaccinated, the proportion of cases will be higher among that. But again, we have 70% of people fully vaccinated here. So the unvaccinated represent a disproportionately high part of the cases, given that they represent a smaller part of the population. But more importantly, the population of unvaccinated are way overrepresented in the serious outcome category. That is hospitalizations, ventilator use in the hospital, and death. And so really, nearly everyone who's dying from COVID in our community is unvaccinated. And that is very sad when we have the tools to really prevent that from happening.
This final question is from an O'Hara resident. When will the county wastewater surveillance data be made available to the public? And will it have the retroactive data back to October when surveillance started to be able to compare Omicron with Delta?
Thank you for that question. It's nice to get a question from a resident. So we, as I mentioned earlier, really are just developing our wastewater program. We've been sampling since the very beginning of November, and I did share some of that data at the Board of Health meeting, and I will continue to share the data as it becomes available. We are currently working on an internal dashboard to examine the data, and we hope to have an external dashboard available at some time, but we don't have a future date. But if you continue to be interested, please, you can reach out to our Public Health Information Officer, who would be happy to check in on the data as it becomes available. Thank you.
And that was our final question. If there are any closing remarks.
Thank you, Dr. Bogan, and again, your team that continues to work on all our behalf here in Allegheny County to keep us safe. We again are hopeful that as these numbers start to plateau, that we will follow some of the, again, trends that have happened in other places around the country and around the world, and that we will start to decline in the positivity. But again, the vaccine numbers become more and more real as time goes on, and how effective it really is. So the more and more that we can convince our loved ones, our friends, our neighbors, our family members to go make sure they get that vaccine, get that booster if they haven't had it yet, that's really the best path forward. So again, we want everybody to be healthy. You're starting to hear again some of the Pfizer and Moderna executives talk about that they see hopefully a path forward in normality in the coming months. And again, that'll be the case. We hope that is the case. But we still, as Dr. Bogan said, you're in a crowded place, you're in a room with a lot of people. It is certainly in everyone's best interest to be wearing your masks in those type of settings. So everyone do their best, and let's get vaccinated with everybody else, and we'll be back in a couple of weeks.
Our next regularly scheduled briefing is Wednesday, February 2nd at 4 p.m. Thank you for joining us.